Now, they ruin lives, blight communities and lead to more than 2,500 deaths a year in England and Wales. But what's the best way of tackling the scourge of illegal drugs? Last month, our guest of the day, Crispin Blunt, encouraged Theresa May to consider decriminalisation.
On the whole issue of prohibition of drugs globally, can I draw her attention to the fact that global policy is beginning to change and that in the face of the evidential failure of the policy since the 1961 UN Single Convention on prohibition of narcotics drugs, and will she look at the evidence that's going to emerge in the United States and Canada on the legalisation and regulation of cannabis markets there, as well as decriminalisation in Portugal and elsewhere?
I do just have to say to my honourable friend that I take a different opinion from him in relation to drugs. And I think that those who are dealing with people who have been affected by drugs would also do so. I think of my constituent, Elizabeth Burton Phillips, who set up Drug Fam after the suicide of her son, who was a drug addict. The work she is doing with families who are affected because a member of the family is on drugs, and the incredible damage that can do to families and to the individual concerned. I'm sorry, I say to my honourable friend, I take a different view. I think it's right that we continue to fight the war against drugs.
Theresa May in the Commons. Well, we're joined now by Peter Hitchens, who is an ardent opponent of decriminalisation. Welcome to the programme. Just before I come to you, Crispin Blunt, you asked the Prime Minister to look at evidence from Portugal. What, in your mind, is the strongest bit of evidence from there? Well,
Portugal have only gone a very small part of the way. They have decriminalised as far as the users are concerned, the people right at the bottom of the drug chain, as it were. And what they're finding is that the public health impact you might have expected by relaxing the law as it applied to people who are then found consuming drugs hasn't actually led to a massive increase in drug consumption. Indeed, as far as deaths from opiate use are concerned, those numbers have gone in a hugely positive direction. And talk to Portuguese politicians who have been responsible for this, they are very proud of the changes they've made in Portugal.
Right.
It's meant their public health position is infinitely better than it was before they made these changes. But it's only a very small part of a wider discussion.
Do you take that evidence from the Portuguese model? Peter?
Well, anyone could look at my blog and the long entry on the alleged Portuguese drug paradise, which has been hugely overrated by propagandists for drug legalisation and decriminalisation. It's not been anything like the great success claimed. Portugal, in any case, had very feeble drug laws before they were changed, and lifetime use of some drugs has increased since. The real place to look at is England, where the decriminalisation of drugs has been continuing in this country since 1974-ish at an amazing and increasing rate, but never officially acknowledged, and which has been, I think, a pretty unmitigated and indefensible disaster.
Right. I mean, how would decriminalising these drugs, Crispin Blunt, actually reverse the trend of 2,500 people dying from the illegal use of drugs in the UK in 2016, up from the previous year for the fourth year in a row?
Because there are groups, whilst the Prime Minister quoted one lady who's a constituent who set up this organisation, Drug Fam, there are other organisations out there called Anyone's Child whose children have gone off to concerts or to discos and whatever and have used ecstasy, as an awful lot of our young people do when they go to these places. The ecstasy is, of course, criminally supplied. They don't know what's in it, and then their child has died because they've consumed something that they didn't expect.
Mr. Blunt,
and the issue is, if we stay with the current position, the supply of all these drugs remains in the hands of criminals.
Right.
So how do we get to a place where we can regulate and control what people are going to put into their bodies?
Midlife crisis that Conservative politicians sometimes go through, and which flings them into this absurd position.
Well, you see,
you're simply spouting. You're simply spouting. Well, the evidence is that, of course, all these drugs are unpredictably terribly damaging, that legalising them doesn't make them any less damaging. The most common legalised drugs in this country, alcohol and tobacco, are regulated and are still fantastically dangerous to those who use them. They're also, actually, as a matter of fact, still very much the subject of criminal gang activity too. So both of the main planks of the decriminalisation argument are feeble. But what you really must understand, Mr. Blunt, is that decriminalisation de facto has already taken place in this country. In 1994, John O'Connor, a former head of the flying squad, said that cannabis was a decriminalised drug. The damage that it does is not actually killing people, but it is increasingly clearly correlated with serious irreversible irreversible mental illness.
And that doesn't.
There is a huge, cynical billionaire greed campaign which seeks now to go to the next stage of legalisation, advertising, sale in supermarkets, sale on the internet, and more people and their families suffering permanent, irrevocable misery.
You say there would be health improvements, but not on the basis of what we did
the issue about cannabis. Our cannabis is an illegal drug. It is therefore supplied by criminals, and 90% of the cannabis that is supplied is street cannabis.
And what about using it?
Is therefore the cannabis that is most strongly linked to mental illness and psychosis.
Right.
So Peter has a perfectly good point in that sense that it's dangerous. Of course it's dangerous. But
so how would decriminalising it further make it better health-wise?
Because if you were then in a position where you know what you're getting because it's legally supplied and it's regulated and licensed and regulated to whatever standard is appropriate around the drug.
Do you get this stuff?
Well, hang on.
No, sorry. This comes out of a Christmas cracker. You haven't answered my simple point. Cigarettes are regulated. Cigarettes are legal. Are they safe?
No, they're not.
Of course they're not, because fundamentally tobacco is not a safe thing to smoke.
Nor is cannabis under any circumstance. Hang on, answer the point.
Advocate the legalisation.
Gentlemen, wait, you talk over each other, no one can hear.
No,
I mean, but look at
I don't get a word in.
You'll get a word in. But I mean, if we look at the example of Portugal, since that's the one we've cited, when they decriminalised the possession of drugs in 2001, HIV infections and drug-related deaths did drop, and the fear of a spike in drug use didn't materialise. Are those not the health benefits that Crispin Blunt is talking about?
First of all, the Portuguese drug problem, as I said, was not very great, and by comparison with some other countries, it wasn't a particular problem. And also, my point is not about deaths from drug use. My point is about and most particularly about the billionaire-backed, hugely financed campaign to which Mr. Blunt has fallen victim to legalise this drug so that people can make enormous amounts of money out of selling a drug which will bring misery.
That is a different point.
This is where we need.
Nobody can really maintain that this drug is seriously prohibited in this country.
Let me let Alison
the only impact you can make is to get it legalised.
I think this is a regrettable way to have a very serious discussion.
Oh, why?
I think that because you keep interrupting and because it's become an attack on Crispin, whose position I don't entirely agree with, to be honest with you, but I would prefer us to look objectively at the science, to marry that with our ambition for good mental health in this country, which we're singularly failing to fund, and decent, proper policing by consent, which we're also failing to fund. But I think if we continue to just throw rocks at each other like this, we'll never get to a proper policy.
Is that what you're doing, Peter Hitchens? Are you actually just ignoring what are health benefits that have been pointed out by Crispin Blunt and others? You do take a different view, but is it going to help actually deal with the scourge of drug use?
I'm simply pointing out that the major health threat from the cannabis, whose decriminalisation he appears to support, am I right in that? You support the decriminalisation. You appear at what I call
licensing and regulation.
The Adam Spliff Institute calling for that the other day.
And we are going to see, from the results of Canada moving to this place in the middle of
I was asking you a question. I didn't want another.
But Peter Hitchens, he said yes, he does want to decriminalise it on cannabis.
Then let me proceed to my point.
Hang on.
You're interrupting me at the moment, Mr.
Right, but let Crispin Blunt answer your question first.
He's answered my question. He's in favour of decriminalising cannabis. That's my next point.
And the reason being, as Peter is claiming, it is dangerous, the stuff that people take. Now, yes, I would agree that it is. And one of the reasons it's more dangerous than it needs to be is because it's supplied by criminals who don't give a monkeys about the effect it has on people. And all I want to do is to look at the evidence that is now going to emerge from Canada and from states in the United States as far as cannabis is concerned, but also look at the evidence about the danger the criminalisation of this $500 billion industry a year has done to states like Mexico, Colombia, Guatemala, Honduras. This goes much wider in the United Kingdom. This is a global issue.
Right,
and the global war on drugs has failed. It has passed a massive industry into the hands of criminals who, strangely enough, fight and kill people in order to maintain their market share. And there is a better and safer way of doing this.
And shouldn't it at least be considered, Peter Hitchens? I mean, even giving young people a criminal record for possessing cannabis can ruin their lives. Is it worth it?
Of course it can ruin their lives. That's the whole idea of having a law against cannabis possession, to deter people from having anything to do with a drug which can also ruin their lives and has indeed ruined ruin the lives of many young people and ruin the lives of their families, which is what it does, and which will be the result of the thing that you're campaigning for. Now you're interrupting me.
Should alcohol be banned as well?
No, because it's too late. If alcohol were being introduced now, and had the same level of use of cannabis, then indeed I would be very much in favour of preventing it from doing so.
Peter Hitchens, thank you very much.
Oh, that's it. That's all I get.
It is, but that was quite a lot. We'll get you on again.
It was worth
thank you, Peter.
what I got in that case.
Good. Thank you for coming on.